Fresh frozen plasma is administered to replace option A clotting factor, option B erythrocytes, option C leukocytes, option D platelets. The correct answer is clotting factor. A patient who has been experiencing angina has a new prescription for nitroglycerin. Which of the following should the nurse include in teaching about side effects of nitroglycerin? Option A headache, option B shortness of breath, option C bradycardia, option D hypertension. The correct answer is option A headache. Common side effects of nitroglycerin: headache, dizziness, nausea, vomiting, rash, low blood pressure, weakness, blurred vision, fast and shallow breath, cold and clammy skin. While caring of the patient with acute pulmonary edema, which of the following is not advisable? Option A IV fluid, option B diuretics, option C proper position, option D reducing anxiety. The correct answer is option A IV fluids. A nurse should teach a patient to withhold the prescribed dose of digoxin if the patient experiences option A breathlessness, option B chest pain, option C visual disturbance, option D increased urinary output. The correct answer is option C visual disturbance. The primary action of digoxin is ability to increase the contractility or strengthening of myocardial contraction. By increasing the myocardial contractility, the digoxin directly increases the cardiac output, this alleviating the symptom of heart failure. The increased cardiac output results in increased urine production and desirable reduction of blood volume. The reduction of blood volume relieving distressing symptom of pulmonary edema and pulmonary congestion. Side effects of digoxin are nausea, vomiting, fatigue, anorexia, dysrhythmias, visual disturbances. Onset of action is 30 to 60 minutes. Normal digoxin level is 1.8 nanogram per ml. Antidote of digoxin is digibind. A nurse should infuse blood drugs to a patient within 4 to 6 hours in order to lessen risk of option A bacterial contamination, option B febrile reaction, option C thrombus formation, option D platelet aggregation. The correct answer is option A bacterial contamination. The nurse in the coronary care unit should observe for the most common complication of myocardial infarction, which is option A hypokalemia, option B anaphylactic shock, option C cardiac dysrhythmia, option D cardiac enlargement. The correct answer is option C cardiac dysrhythmia. Complications of myocardial infarction: cardiogenic shock, heart failure, pericarditis, cardiac rupture, dysrhythmia, angina pectoris, thromboembolism, ruptured papillary muscle, Dressler's syndrome. Dressler's syndrome is a secondary form of pericarditis, also known as post-myocardial infarction syndrome. The purpose of water in the water-sealed chamber of a chest drainage system is option A faster removal of chest secretion, option B prevent the entrance of air into the pleural cavity, option C facilitate emptying of bloody drainage from the chest, option D decrease the danger of sudden change of pressure within the tube. The correct answer is option B prevent the entrance of air into the pleural cavity. Which of the following drug is to be given when warfarin overdose is observed? Option A, heparin. Option B, vitamin K. Option C, protamine sulfate. Option D, iron destran. The correct answer is option B, vitamin K.